Hi, I'm Beth Battolino, CEO of Healthy Women. Thank you for joining us today on Healthy Women's first talk show, WomenTalk.
Hello and welcome to Women Talk. I'm Beth Battolino, CEO of Healthy Women and your host of Women Talk. Together with the National Association of Nurse Practitioners in Women's Health, we've got a special series of episodes planned for you. We'll be exploring the important role that nurse practitioners play in women's health. Our conversations will take an ages and stages approach to contraceptive care, maternal health, and menopause. And to kick off our first episode in our series, we'll discuss new contraceptive options, how safe and effective they are, and what you should be asking if you're thinking about contraception. And there's no better guest with whom to have this conversation than Danielle Grimm. Danielle is the women's health nurse practitioner, public health professional, and the clinical director at the Dimmock Center in Boston, the first hospital in New England to be operated by women for women, which I absolutely love. Thank you, Danielle, for joining me for this important conversation about new contraceptive options. Let's dive in.
Awesome. Thank you, Beth. Happy to be here.
So to kick things off, can you tell our audience, Danielle, what women's health nurse practitioners are and what made you pursue this path?
Absolutely. So a women's health nurse practitioner is an advanced practice registered nurse who's gone through additional training, clinical training, didactic training, and a specialized certification to assess, diagnose, and treat the healthcare needs of women throughout their lifespan. We provide a range of care from menarche, which is the time period where a patient will have their period for the very first time, all the way through reproductive age, including preconception, conception, prenatal care, postpartum care, and through menopause and advanced stages of a woman's life. We are trusted health professionals that are on the front lines of supporting women as they navigate contraceptive choices. I became a women's health nurse practitioner after pursuing first a career in public health. I have always been very passionate about women's health, women being leaders. My undergraduate degree was at an all-women's college, Smith College. So been very much ingrained in women and female leadership from an early age. After that, I got a degree, a master's in public health from Boston University. And I really fell in love with the idea of small interventions that could have big impacts. So what can we do on a small scale that could really affect an entire population? Within that, right, there's the idea that when women thrive, communities thrive. So that kind of drew me a little bit more towards women's health further when we think about kind of the effect of, say, encouraging breastfeeding on how that may impact a population's overall health when you're starting a child off with that. So with that, I kind of grew a little further of wanting to have some individualized impact and pursued nursing and then became a nurse practitioner, a women's health nurse practitioner, and I've been practicing for the past 12 years.
Oh my God, all I can say is your patients are so lucky to have you. I love that story. So thank you so much for sharing it. As we think about contraceptive choices, and I love the fact that we have more choices today, what role do you play as your patients are considering either starting contraceptions or perhaps changing contraception?
Yeah, so one of the true honors that I have, especially because I'm at a community health center, we're a federally qualified health center, is I really am seeing patients from a very young age. So I've had the kind of benefit to start seeing, say, a patient at age 18, and now we're, into our 30s or vice versa, because I've been here for a while. So I've been able to see their sort of evolution as they've kind of grown up, so to speak, or their life has changed. And one of the main things that my my role is to be that sort of trusted person that they can ask questions. So in terms of contraception, I'm there to provide all of the up-to-date information, what is available, what is new, what is the latest research. It's constantly changing, which is a good thing. There's many advances happening all of the time. And I'm also there to work through what's working and what's not working. Just because you are considering contraception doesn't mean you're kind of boxed into one option, right? We are fortunate there's many options. And so it's that shared decision making that is fundamental to a good patient relationship, and something that women's health nurse practitioners are always thinking about when we provide care.
It's so important. And I do think I love the fact that you really look at the ages and stages approach and the education, because if you are able to put someone on a contraception that really works well for, for them, chances of them staying on that for a longer period of time and being compliant is so much higher, right? And I just remember even when I started contraception, it was important because at that time we didn't have a lot of options. So the compliance thing was super important. But I love the fact that this is really now a part of the education and just listening. It sounds like you really are able to have that time to listen to your patients and understand where they're at and what potentially could work from that for them. And as you mentioned a little bit about new options, the O-pill that came out recently. Can you tell us about some of the O-pill and some of the new options that you're educating your patients about and prescribing?
Sure. So the O-pill is such a game changer. I recently, probably maybe 4 or 5 months ago, was getting lost in Costco, as most people would, right? And I was on the phone, I'm a clinical director, I was on the phone actually with a colleague and walking through the store, stopped dead in my tracks. And I saw this huge display of the O-pill. And I was like, this is the most amazing thing I think I've seen. I had to stop. Yeah, because just the level of access is just astounding. And it probably sounds a little over the top to, brings a tear to my eye, right? Because it is so monumental, again, when we think about access, because that is really the biggest barrier to women continuing on and starting a contraceptive method. So any option that can be readily available is huge. The O-pill in particular is a once daily contraceptive pill. It contains one hormone. Typical birth control pills or contraceptive pills are combined methods, which contain an estrogen and progestin. This pill contains one hormone, progestin, that works to prevent pregnancy by thickening the cervical mucus. So what that means is that it helps kind of block sperm from entering into the cervical canal. And in addition, the hormone helps prevent ovulation, which is the monthly release of an egg. So you've got this kind of twofold approach: prevent an available egg, but then also preventing the sperm from getting there. It's 98% effective at preventing pregnancy when used correctly, meaning taken at the same time every day. And it starts working 48 hours after the first pill, which is pretty quick. Some of our other methods, we counsel that it may take a week, but 48 hours is pretty darn good.
That's awesome. Yeah, that is the game changer. When we think about some of the newer options right now, I know questions that we get from our audience is about the safety and effectiveness of the newer options. Are you hearing the same in your practice?
Yes. I think that is one of the biggest things we talk about. How safe is it? I always think of it as how safe is it and how effective is it, right? Those are kind of the two things that people want to talk about. In terms of O-pill, because it only has one hormone, it is relatively low risk. I use the word relative because as I do counsel my patients, everything comes with risk. And let's be honest, having unprotected sex comes with risk.
Right.
So I always like to point that out because every medication comes with risk and many activities come with risk as well. And when we also think of effectiveness, I also joke, which I usually get a big laugh out of my teenage patients. I mean, the only birth control option, contraceptive option that is 100% effective is no sex at all. So, right, we have to kind of meet in the middle, so to speak. So when we think that everything comes with risk, the O pill is pretty minimal and can be used by women with other health conditions that maybe would eliminate them from other options. So I think about things like high blood pressure, or lifestyle things like smoking tobacco. You can do those things or have that while taking the O pill. So that is also why I feel comfortable that it's over the counter and readily available.
Really good points to tease out. So thank you for doing that. So are any of your patients running into hurdles in getting the contraceptive pills or the devices that you've been prescribing? Have you had any internal hurdles in getting what you feel is the best option for your patient, like approved or covered?
Yes, it's a tricky question, to be honest. So, as I mentioned, we are at a federally qualified health center and we do receive some Title X funding, which helps bridge the gap between contraception cost and access. But there's still issues. So, I'm in the Boston area. The majority of my patients are Medicaid, which here is called Mass Health. Mass Health is very clear that they cover birth control up to a year's supply. Right, but that's also vague, right? We cover birth control for a year's supply, but it doesn't necessarily say which exact ones and will that actually be covered for you, right? So it really brings up a lot when you think about institutionalized racism and access, because you may not be able to get all of the options that are out there because of your insurance and where you are located. I have a patient who has tried many of the different birth control options. We mutually agreed that the hormonal ring was the best option for her. But her level of insurance within this mass health system did not cover the ring. It would cover the combined pill, but she just isn't, compliance is not there for her with that method. And so what we are able to do in kind of those cases with our grant funding is we actually will order some of the hormonal ring, have in stock, and dispense it from our clinic to be able to kind of bridge those gaps. But I will say that's not even the case for just the Medicaid population, even private insurances. I do have some patients with private insurance, and not to harp on the ring is a great option, but it's the same thing with the ring. She has private insurance and her monthly copay for the ring was $230 per month.
Wow.
And that's not, we all know where groceries are $200 every time you go, it feels like. So that's not a small thing. And so there are still significant cost issues. And that's just kind of things that we prescribe. There's other sort of hurdles when we think about long-acting contraceptive devices like IUDs or hormonal implants that go in the arm. Those are expensive devices. They are meant to be in place for many years. So they are, at the end of the day, cost effective because you have insertion and it may stay in for 5 to 7 years. But there is sometimes challenges getting those devices and then getting patients back to insert them. So here in the clinic, we actually keep a lot of those in stock so that if someone would like one of those devices, I can do it in the same day if they're eligible.
Oh, that's great. That's great to hear. But it's so unfortunate to hear that I still feel like we're still trying to change, access to care and access to contraception. So it sounds like Healthy Women still has a lot of work to do on that side of it. But I love the fact that you're able to have those in supply. And again, the education that you provide your patients and the hand holding and guidance and really explaining the options that's what I always like. The nurse practitioners in women's health do such a great job with that. So my last question to you is, as you know, our audience are mainly women, 35 to 64. Again, they can skew younger or older, but as they're, preparing for a visit with you and thinking about changing or going on contraception for the first time, or maybe they're going through perimenopause and thinking about a contraception to help alleviate some of the swings and the changes that they're experiencing, how should they prepare for their visit? What would be the most helpful for you?
Yeah, so what I would say is kind of take stock of their current life. Have a little bit of a self-reflection moment. What am I looking for? So what are my goals as a patient, right? Are my goals to prevent pregnancy? Are my goals to help with mood? Are my goals to help with acne? I'm 42 and my periods are all over the place. Is my goal to have some menstrual control? Is my goal to not have a period at all? I would rather have contraception and not get a monthly period. So kind of what are my goals? Also, what is reasonable with my lifestyle, right? So am I okay with something living in my body for a few years, right? Would that bother me? Am I someone who could take a pill every day and remember it? Or am I someone who I'm losing my car keys every day? There's no way I'm going to remember to take a pill. So kind of thinking about those things can help guide the conversation when you come to see me. And I think also, and I provide this in my sessions, is having this sort of discussion that this is a mutual sort of arrangement, so to speak, like we're working together. So reach back out if something's not working or we're not reaching the goal that you have in mind. Because like you mentioned, there's tons of different options. And so we may be able to come back together and find something that works.
I love that. And so just to recap, it's like understand where you are right now and kind of thinking about, do I want any more children? Maybe I just had a baby and I want something right now that I can start taking, when I get home from the hospital. Am I going through, am I 35 or a little bit older? And I'm just noticing my periods are shifting. So understand where you are right now. Come prepared to ask some questions, and just make sure that you bring up the idea of, yes, I'm ready to change contraception or start a new contraception. And knowing that if you go home with a prescription and it's not working, they can reach out and say, hey, this is not, I thought this was going to be the contraception option for me, but I just feel like it's not working. Can we talk about another option? Right? Because now we do have more options, and making sure that it's a two-way dialogue and that patients know that it's not one size fits all, that they can call you and get that extra advice and say okay, it's not working. Let's talk about it and figure out what other options might be best for you. But I think the most important thing is knowing that there's new options in contraceptions and that nurse practitioners in women's health are there to help support and make sure that you're comfortable with the options and the choices that you make.
Yes, absolutely.
Great. Danielle, thank you so much for your time today and for sharing a little bit about your history in women's health and why you chose to be a nurse practitioner in women's health, but more importantly, for the care that you give your patients. Thank you for joining us. And thank you all for tuning into this episode of WomenTalk. For more information on this topic, please visit healthywomen.org and tune in for our next episode in this series on nurse practitioners and maternal health. Thank you all and have a great day.
Thanks for joining us for another episode of Women Talk. Stay tuned for more Healthy Women live events at www.healthywomen.org. You can also follow us at Healthy Women on Facebook, Twitter, YouTube, or LinkedIn, or follow us on Instagram at healthywomen.org. We'll see you next time.